at least in Lagos, I have heard that a child up until 2 is supposed to be seen free. Are these things really being done?
The question is, when you say free, is it free? A child comes in with diarrhea in children doesn't mean it's straightforward diarrhea.
Okay.
You could have other diseases mimicking diarrhea, basically presenting as diarrhea. That you might need to do tests, do investigation, admit and treat, basically. But the sincere truth is, if you get to look at the population that goes to the government hospitals, how many really? Is it sincere true health, or we just making free health, or just saying free health on just for people to we are saying free health, but are we giving quality health? That's another question.
But why wouldn't quality health be given?
No.
What would be the things stopping quality health from being passed on to these people?
At the state level, they say health is free, but at the federal level, health is not free. I work in the teaching hospital. You have to pay, basically. You have to pay for your drugs. You have to be able to pay for your admission. So even when the state hospitals are filled up, the federal hospitals still take a bulk of it. So the bulk of the patients that come in there, how much they have in their pockets, the financial capability, the financial empowerment of the parents actually becomes a question, apart from the fact that the delay in presentation at times. So then, and as pediatricians, as a pediatrician, I tell you, even at times, doctors have to go out of their way, basically, within their own monthly salary and say, okay, this child is dying, let's help you contribute. How many kids are you going to contribute for, basically? The bulk of the population still lives below poverty level. So even though we are saying we are improving, but the bulk we see, the bulk we make contact with, the national health insurance thing is there to help them, but even within the national health insurance program to help is not working for everybody. If you don't have a work, if you don't belong to a company, you might not be able to get the health insurance. So imagine a parent that are jobless, basically, that are not then they want to go, they don't have access. So part of what will help is for the NIH too, which was a dream for the NIH. It was supposed to start in phases, but on the long run, it's supposed to help everybody, whether you have a job, whether you don't have a job,
to have access
to health, irrespective of your financial background or your social status.
Okay, we'll take a break now. When we come back, we'll continue some of these issues. Please stay with us. We're taking a break, a very short break. Stay with us.
Always starts with a good show of sportsmanship, but everything changes when it's time for action.
Deep sucks it up and gets what a shot!
Well, he's taken a narrow lead here over.
It's gone in.
In this fast-moving world of sports, the moments are intense, exciting, engaging, and mind-blowing.
A superb demonstration of power sprinting.
Here at China Sports, we won't only bring you the action, we get you involved. Through our different sports programs, we highlight your magical sporting moments, dissect the issues, let you share in the celebrations, and ultimately become the champion. Channel Sports, the final the moments of true sports.
Welcome back. We're discussing reducing child mortality on Health Matters, and Dr. Salako is in the seat. You can call now with your questions or contributions. The number to call is 012206-842. That's 012206-842, and you can tweet at Mary Alale. We'll get your messages here. Now, Dr. Salako, we've spoken about pneumonia, diarrhea, malaria, preterm birth, birth asphyxia. What are some other things that are major causes of the death of under 5s?
The other major cause, in fact, apart from some pneumonia, all these, for under 5, some pneumonia, diarrhea, or respiratory tract infection together, malnutrition is still a major issue, basically, in sub-Saharan Africa and in Nigeria. Over a percentage of our kids, in fact, still are underweight. And that's the major one. If you are not well nourished, then the ability to fight immunity or build a world immunity becomes questionable. So you are more like an easy ground for every other disease to get to. The other thing is HIV/AIDS.
Okay.
HIV/AIDS, it's another thing.
But we have this prevention of mother-to-child transmission.
Yes, the government is doing so much on that. They are doing well. We are able to more or less save babies basically from having the disease. But the question is, there's still that no matter how small the stigma is, there's still those who believe once they have the disease. There's some nonchalant people who will rather not present early in pregnancy. They have the disease. They will not present in pregnancy for adequate treatment for PMTCT, and also they will even not deliver. Now goes back to the neonatal the neonatal.
They wouldn't come to the hospital to deliver.
You still have. We are still saying that in Africa, in Nigeria, a bulk of less than 50% of our patients present at the hospitals for delivery.
Less than 50?
Yes, a bulk still deliver at home. A large chunk. But
mostly in the rural areas, right?
In the rural, even in Lagos, you still have those who patronize. So Lagos State, or the government itself, they are doing so much to train the traditional birth attendants. But how many, basically, are they going to be there today to look at their activities, basically? And some will always go through the back doors, typical Nigerian way. But that is also a major problem. Now, when they now know that, okay, we have the disease, instead of them presenting early or bringing the child within as soon as possible so that the child can start ARVs, PM, for prevention of the disease,
of the mother-to-child transmission.
They don't, because of the fear of stigmatization, because of the fear of the homes being broken down. Also, it's a major challenge. So we still need to continue to work on that. We still need to continue to encourage mothers. We still need to, the TBAs, as much as they are trying to integrate them into the normal health system, there should be room for standard baseline tests. Check the mother's HIV status from the blood levels, who do the hepatitis B level, who check in pregnancy. We need
which are also causes hepatitis B.
Yes,
and
we need to check, and because that can also be transmitted from mother to child. We need to integrate this. Either as much as you don't want to push the government doesn't want to push them out. It's been a way of life basically that has failed to fade out. We need to integrate them, even if just for the standard test. And when you pick high-risk mothers who are HIV positive or high risk, then they shouldn't stay back to deliver the traditional birth attendant home, basically, and should be referred immediately.
This traditional birth attendant, are they trained? Are they legal?
It's been a form of delivery system, and at least since the democratic setting, Lagos, at least I'm aware, since I'm in Lagos State has done so much to train and ensure they embrace healthy health practices, so that you can prevent mothers and also kids. But we can reduce maternal mortality.
We have a call coming in. Hello, Philip from Lagos State. Hello, Philip.
No, I say you can't.
We can hear you, Philip. Could you?
Hello, good afternoon.
Good afternoon, Philip.
Yeah, I want to ask the doctor, what are we doing about? Hello?
Go on.
Yeah, when you spoke about malaria and I wanted the doctor to put more light on what we're doing about malaria, where people can, apart from just sleeping under the net, winter, what can we do to tackle the effect of malaria? Because the people in Nigeria are just suffering from malaria.
Okay.
What are they doing?
I'm getting that. I got it a bit sketchily, but basically, what is being done? What more is being done about malaria to at least reduce the risk of death from it?
The other thing that has been done basically is as much as possible the cost of anti-malaria, the availability and accessibility in relation to cost and its availability. The government has looked into it, and that's why you get, apart from the fact that there are so many brands, they are easily accessible. And even the World Health Organization is doing so much, basically, especially with the Coartem, basically. And so for as low as 200 naira, basically, you can get a sachet that you use basically to treat your child. And apart from that, at the home front, we need to, as individuals, malaria would go in an endemic area, but how clean is the environment? How clean is the environment?
Cleanliness is a big issue when it comes to malaria.
It's a big issue.
But you know, malaria is more expensive to treat now than it used to be. In the days of chloroquine, it was so cheap.
It was cheap, but we are
But
looking
with this
at
artemisinin,
resistance is a big issue. Chloroquine resistance is a big issue, and we are looking at that's why the artemisinin is an artemisinin based. So that as much as possible, you reduce resistance, and you can win the war against malaria. We are an endemic malaria area. We can't beat that, but simple hygiene. Not keep it stagnant water. It's not just stagnant water. You soak it, you leave clothes soaked, or you fetch water down for days. The larvae is easily we settle, or the mosquito easily will settle, produce their own eggs, and it's another bad mosquito. So
let's quickly talk about, because we don't have so much time, let's quickly talk about a term I came across concerning preterm birth, which also is one of the killers. What is the kangaroo concept?
The kangaroo,
and does it work?
Yes, it does work, and it's doing, in fact, it's done wonders over the world. And basically, especially even in the developed world, and it's an advocacy, basically, to all the third world countries, but the question is, at what time do you want to start the kangaroo mother care? It's like the mother starting as a pouch. You more like
she's like the incubator.
Yes, incubator. But outside now, it's more than this program, basically.
Okay.
But the
body heat is what we are talking about here.
The positioning is important, but it's not all preterms. Basically, that you want to drop immediately into the kangaroo system. Basically, you need to be sure the child doesn't have any respiratory distress. There's no respiratory disorder, basically. So that you can't drop, and to some extent, the weight is also appreciable. So you won't be dropping a 900 and asking the mother to start a KMC, basically. Okay. So you want the child stabilized, it has sepsis-free, respiratory distress.
Okay, so it's beyond this program, really. Okay, thank you so much for coming on the show. Talk about child mortality. There's still quite a bit to talk about, yes, I can tell, but this has helped a great deal. At least we know that mothers should be more vigilant, go to the hospital in time. Don't hide from your status for the sake of your child. Thank you so much for being on the program with us, Dr. Salako. Thank you, viewers, for being with us. Thank you very much for calling in and tweeting. Sometimes the tweets don't come right on time. You have a great day. My name is Mary Alala Yusuf.